Hi, my name is Maria Perez-Rojas, and I'm a respiratory therapy student at Miami-Dade College Medical Campus Center. Today's topic is going to be about PAP as an adjunct of bronchial hygiene therapy. PAP stands for positive airway pressure, and the equipment I'll be using today is called EzPap. Before I get into the procedure, let me address some important details such as indications, contraindications, and possible hazards and complications. Indications for EzPap is to reduce air trapping in patients with asthma and COPD, to help mobilize retained secretions in patients with cystic fibrosis and chronic bronchitis, to prevent or reverse atelectasis, and to optimize the delivery of bronchodilators in patients receiving bronchial hygiene therapy. On the other hand, EzPap is contraindicated in patients unable to tolerate the increased work of breathing, intracranial pressure greater than 20 millimeters of mercury, hemodynamic instability, recent facial, oral, or skull surgery, esophageal surgery, untreated pneumothorax, acute sinusitis, and epistaxis. As any other medical procedure, EzPap has its possible complications and hazards. These can be the increased work of breathing leading to hypoventilation and hypercarbia, cardiovascular compromise, and air swallowing, increasing the likelihood of vomiting and aspiration. First thing that I'm going to do to start the procedure is to check in the patient's chart for the physician's order of EzPap. Prior to coming to the patient's room, I'll make sure to knock on the door and wait for authorization to come in. I'll introduce myself as a respiratory therapy student and explain the nature of my visit in terms that my patient or his relative would understand. Hi, Ms. Sanchez, my name is Maria. I'm a respiratory therapy student, and I'm here today because your doctor ordered EzPap to help you clear out your retained secretions. Before I attempt to do any patient assessment, I'll make sure to perform hand hygiene by either washing my hands for 15 seconds or utilizing the alcohol-based hand rub, which for these video purposes, I'm only gonna verbalize. Once I'm done with hand hygiene, I'm gonna proceed to don my appropriate PPE. For this particular procedure, I'm only gonna use or need gloves. I'll make sure to verify my patient's identity using two identifiers. These can be name or medical record number. Then I can proceed and assess my patient's vital signs, respiratory rate, heart rate, blood pressure, temperature, and SpO2, and breath sounds, which I'm also verbalizing only. To start the therapy, we're gonna use, as I mentioned before, the EzPap, and which you should gather prior coming to the patient's room. An oxygen tubing and a nose clip also are going to be necessary. This equipment consists of a manometer, which is going to tell me if the patient achieves an airway pressure of 10 to 20 centimeters of water, and a mouthpiece. I'm going to proceed to connect my oxygen tubing to the flow meter. It can either be oxygen or air, because this therapy is basically more an exhalation. And the other end, I'm gonna connect it to the equipment. I'm gonna attach my mouthpiece or filter to the equipment. And I'm going to set up my flow meter at 5 liters per minute. Position your patient in the correct position. Ms. Sanchez, I'm gonna need you to sit up straight and comfortably. Okay? And then I'm going to proceed to instruct my patients how to use the equipment and how to go through the therapy. Okay? This is how are we gonna do. You're gonna form a tight seal around the mouthpiece. You're gonna inhale from your diaphragm to a volume greater than your tidal volume, but not to your total lung capacity. At the end of inspiration, you're gonna exhale through the one-way valve, trying to achieve an airway pressure of 10 to 20 centimeters of water. All right? Very important to know that the exhalation has to be actively but not forcefully, and also try to make it last 3 times longer than inhalation. Okay? Then you're gonna do 10 to 20 breaths followed by 2 to 3 half coughs to clear out those loosened secretions. Okay? I'm gonna place this clip on your nose. This might feel a little bit uncomfortable. It won't hurt you. It's just to make sure that the air is coming out through her mouth and nothing is leaking out of her nose. Okay? Here we go. Tight seal around. Inhale and exhale actively. 10 to 20, a little more. 10 to 20 centimeters of water. Good duration of exhalation. Good job. 2 hot coughs. Very good. Very important to let your patient know that this cycle is to be repeated 4 to 8 times during 10 to 20 minute session. All right? And if there is any expectoration, note sputum for quantity, viscosity, odor, and color. Okay? Once I'm done with my session, I'll reassess my patient's vital signs to assess the therapy's outcomes. Okay? I'll make sure that my patient is comfortable and I'll ensure her safety. Ms. Sanchez, we're done for today. You did a great job. Is there anything else I can do for you?
No, thank you.
Okay, I'll remove my PPE, perform hand hygiene by either washing my hands or utilizing the alcohol-based hand rub, and document my therapy's findings in the patient's chart. This has been a video on PAP as an adjunct of bronchial hygiene therapy. My name is Maria Perez-Rojas, and I hope you find this material helpful. Thank you for watching.